who used to be a nurse. The medical tech and legal aid.
Well, a laser one. I want one of those.
The one I got in my kitchen doesn't work well though. I pointed it at my forehead and it's off.
You mean the one with the thermometer with the mercury in it?
It's
As long as it's not the kind my mom used.
Sandra, are you in or no?
No, it's, the invite is going, yes, sure, whatever. The invite really didn't go.
Okay, well, we'll wait till everyone gets their temperature taken. Teresa, can you hear me?
Her back, and then we're gonna rotate.
Teresa?
Okay.
Because the
Okay.
hair does that.
Okay.
I need to turn my speaker on here.
Teresa, can you hear me?
I just turned mine on.
I really can't. I don't know where my audio is.
Speaker off.
When we get,
You got 90.3.
how do you do this? Gee,
Hold the function key down.
almost normal.
Almost normal. Arrow before it fix it, so it's supposed to be up there.
Okay. 10. Okay.
Benny,
Makes your forehead warm.
Benny, I can't,
It really does make
I
your
can
head
only
warm.
hear me through your feedback.
Yeah, so,
You still have air.
F5 to turn it on, because now next to it, it's not very easy.
Like,
Oh, there we go.
okay, so this might get picked up on others. We're gonna get a lot of echo, but
Okay,
I think we're ready to go, guys.
all right. All right, is everybody ready to go?
What's this say?
Jamie? Sorry, Sandra's link is not working.
There's also the password that I think.
Good, how are you?
Yeah,
Yeah, right on your nose, Benny.
Right
Right on your nose.
There you go.
There you go.
I got one of those Walgreens ones.
Ari.
No, no, apologize.
Dress for this.
Now you're right.
Okay, thanks. Normal.
99.6.
You don't care about that.
Well, and this is
You should opportunity to open Zoom or interrupt.
more reliable. Right, we don't have Melissa here today.
Okay. What do you want to put this on? We want
Those are much better. You should have been outside.
So,
Thank you.
I guess if you're, you probably should, we should try to mute a few people for the feedback, Roy.
Yes.
That's right.
She's Alice, the maid on
Yeah.
Brady Bunch.
The council votes. The council
Okay.
I decided. Remember when we were kids? We had the Dick and Jane books.
Yes. Tim Ryan's in the place and fall down.
Is it working, Sandra? But I don't see you here.
I'm there.
You are? I hear you.
I don't see any.
Scroll to,
Scroll it. I see her. Scroll it. Top of your screen. You can scroll left or right. She's all the way to the right.
Okay. All right, everybody ready? Good? Okay. Welcome.
Hear me, Cindy?
Yeah, I can.
Okay, good.
All right, we're ready to go. Ooh, I hear so much feedback. Somebody, Roy, turn your, if you could mute. Sandra, if you could mute, please.
I'm muted.
Okay, thank you, thank you. Whoa.
But I think your computer speaker needs to be off also.
My speaker is on.
Okay.
Okay, everybody's mic off? All right, ready. Good afternoon. Welcome to the Lincoln City Council Directors Organizational Meeting of Monday, April 13th at 2:30 p.m. As you know, we are doing this via youtube.com at Link TV City and facebook.com Link TV City as well. Our mayor and governor have said that the next 3 weeks are critical in our joint efforts to slow down the virus in our state. The governor is asking each of us to just do the right thing. That is why we will be video conferencing today's directors meeting, and we will have a discussion during our directors meeting about if we want to do this for our Lincoln City Council meeting as well. By having this, our first directors meeting to be conducted using video conferencing is not business as usual for us because it is not life as usual for any of us. Your lives and the lives of each of our families depend on us doing the right thing and in doing our part, however big or however small, to keep our community safer. Many families this past weekend shared and celebrated their Easter dinner or their Passover Seder using video conferencing as a safe way of communicating and connecting with their loved ones during these most difficult times. We were elected to serve our neighborhoods, our communities, and our city. We were elected to make tough and clear-minded decisions during regular course of business. Our constituents rely on us and trust us to, most importantly, make the best decisions in times of emergencies. This is one of them. As you know, our federal government, our state government, our county government, and our city have all declared a state of emergency. The governor, by his executive order number 20-03, has authorized a limited waiver during this declaration of emergency that permits all public bodies in the state to meet by video conferencing and other telecommunication applications, so long as access to the meeting is provided to members of the public and the media. Each of my colleagues that is video conferencing has a copy of the Open Meetings Act with them. And we also have a copy of the Open Meetings Act posted at the back of the chamber. We have invited the public to participate if they feel comfortable doing so with more safeguards in place. We ask those who plan to testify remain in the adjacent Luxford studio until your item of business as called. So I'd like to go ahead and go forward with the director's organizational meeting of Monday, April 13th at 2:30 p.m. Are there any adjustments to the agenda? Sandra?
Madam Chair, I thank you for recognizing me. I would like to offer that we move our agenda around and we look at item 8 first, so that there's enough time to discuss that.
Okay, I see no objections, so we will go ahead and adjust the agenda accordingly to discuss. Item number 8 is discuss teleconferencing, council directors meetings, and city council meetings starting Monday, April 13th through the end of April 2020. Yes, did you want to read forward your comment?
Yeah, I would like to move that we hold the next 2 council sessions, April 20 and April 27, by video conference, and that we make arrangements to ensure public participation in accordance with the Open Meetings Act during those sessions. I also move that we hold our next in-person meeting, council session.
I don't think her mic is on, Jane.
Sandra, you were muted.
Just
a second.
Okay.
All right, I am not muted any longer. 2 council sessions, April 20 and April, and that we make arrangements to ensure public participation in accordance with the Open Meetings Act during those sessions. I also move that we hold our next in-person council session on May 4th.
Wait a second, can we divide that question?
We have made a motion. I'm sorry to accept the motion before you had your request to second the motion. There is a motion on the floor by Sandra to go ahead and do video conferencing for our next 2 city council meetings on April 20th and April 27th. And
Yes. I would like to divide the question between the 2 issues.
what are the 2 issues that you want to
The
divide?
first issue is to be voted separately on whether to.
I can't hear anybody now.
We can meet in teleconference. The next 2 meetings is 1 vote, and to convene in person in the first meeting in May is a separate vote.
Okay, let's take a vote on calling the question and dividing the issue on the 2 items. The first item that we'll be voting on is whether we're going to be video conferencing our next 2 city council meetings on April 20th and April 27th.
I'm amenable to a friendly separation of the questions, but I would like to address the first one. So we're just voting to separate.
Automatic separation, but you can have a discussion on the first one, which is, do we want to go forward with video conferencing on April 20th and April 27th?
Madam Chair, since our emergency declaration 4 weeks ago, all of us in Lincoln have made adjustments in response to the corona pandemic. As a community, to shutter or to change the way that they do their work. We've asked employers to allow a liberal work at home policy. We've asked parents of school-age children to help them transfer to online learning. In addition, we've asked that those that could give more to help those who have less. In my hometown, infection, we are going out less, staying in more, and keeping our distance. But at the same time, a great many of our residents have stepped up to provide essential services, and they are doing a phenomenal job providing those services while protecting their own health and safety. For the last month, council members have been in conversation with each other, staff, and the public about our need for a continuity plan for governance during this crisis. I believe the essential work of governing continues whether we are working through an emergency or not. And I think it's good sense that we allow ourselves the flexibility to meet at a responsible and safe distance in order to provide ourselves and staff the same precautions we are asking of others. Lastly, I believe we have the creativity and the technology to do our jobs in full view and with full participation of the public. Thank you.
Yeah, I'd just like to reiterate the fact that the city attorney's office has recommended we not do this.
James?
I would like to say that we have a way to keep the public safe and to not abdicate our responsibility of city business. I will be supportive of this because it's not even necessarily about each council member's individual health and well-being, but about those that we interact with. And we have an obligation not only to make sure that we conduct city business, but to keep every single person that we come into contact with safe also. I think that this is a pretty common sense way of getting our work done and utilizing the technology that's available, utilizing the guidance and executive order from the governor of our state and what other municipalities have done and what our county is doing. So I would be supporting this.
Yes, Richard.
Yes, thank you. Keep wanting to speak into the mic. That one's not muted. Okay. Push the button, doesn't work, huh?
No.
Okay. I'll go ahead. What I was going to comment on a little bit is that I don't personally feel that comfortable about going against the opinions of our own city attorney, and with strong opinions and opinions of other attorneys that also work with villages, boards, and other groups. And so that way, we have a way of being able to conduct business if it's important for the city, why we are suspended our meetings for 2 weeks, and that's through emergency meetings, which can be called and voted, and we can do votes there to keep the city running. I just don't feel comfortable about just continuing as is and putting people's, if it's their projects or whatever they bring it forward to us, possibly in jeopardy by doing that.
Briefly.
We've got to keep moving.
Sure. I agree with Councilman Bowers. I think it's important that we protect the public, we protect the city staff, we protect each other, and follow the advice of our city attorney and law office. And I think we can do all those things, but we have to take a step back from teleconferencing to do that.
All right, I would just like to wrap up the discussion on this. And, you know, we all received a
Jane, I can't hear you.
Okay, I think we all received information from Doug Peterson, the Attorney General, that explained and clarified that initiative, and that we have taken steps to make sure, and most importantly, keep within the intent of Open Meetings Act and the spirit of the Open Meetings Act. As you can tell, we have published this director's meeting as well as the City Council meeting as one that we are going to be televideoing only because we've had discussions. We've had 2 director meeting discussions on this topic. We had an open meeting discussion on this topic as well, on what we should do, what we can do, how we can do our part, however big or small, to do everything that we can to keep our staff, that we can keep the public safer and our own families as well. You know, the Attorney General has issued executive orders from the governor on his behalf on a number of things that we all collectively support and have taken initiative on. So when the governor has said that we can't have gatherings of more than 10 people, we've gone to extraordinary steps right here in this chamber to practice social distancing, physically distancing, safeguarding the public by keeping them in a separate room. We have agreed and concurred with that. When the governor said he wanted to suspend evictions statewide, make it a moratorium on evictions for those that will be harmed and those who have lost jobs or their wages because of this tremendous virus that we're battling, we went along with that one, and we did not object to that one. When the governor said, I want to make sure our bars and restaurants have an opportunity to function and survive, and yet you can carry out liquor and alcohol from the bar and the restaurant, just so long as you had a lid on it. No one objected about that. I think it's very important in times of emergencies that we do everything we possibly can. You know, and it's not just the state of Nebraska that is taking on this issue and suspending certain aspects for a temporary basis, a temporary waiver. We're not talking about for a long period of time. States like Texas, Tennessee, Rhode Island, and Louisiana have all taken these measures. We have to do our part. And now I say, let's get to work. Let's do our jobs as elected officials. We want to continue to meet. We want to continue to meet in a safe fashion so that we can protect our staff, that we can protect the public, and we can protect our own families. And I can tell you that I have had personal experiences with it. My husband had tested positive. My son also had it, and we've done everything we possibly could to get through these difficult times. So that's why I'm standing up here before you all saying that we need to do video conferencing, because that is what has been approved by the governor. That is what we should be doing in these times of emergency to keep everyone safer. So now, Teresa, do you want to call the vote on this item?
What are we voting on? I've missed half of what you guys have been talking about because of feedback or mic's not working.
Okay, we are voting on the first issue is, do we want to vote in favor of video conferencing the next city council meeting on Monday, April 20th? And after that, the city council meeting on Monday, April 27th. That's the first issue.
And who seconded Sandra's motion?
Tammy Ward seconded.
Okay. Shob?
No.
Ward?
Yes.
Washington?
Yes.
Bowers?
Yes.
Christensen?
No.
McGinnis?
No.
Raybold?
Yes.
Motion carried 4-3.
Okay, the next item, Teresa, is we divided the question, and do we want to meet together as a body physically on May 4th? Is that correct, right?
Okay. And who made that motion?
Roy?
Okay.
He divided the question, but we didn't have a second on that one, but I guess it doesn't matter. You don't need one. Okay. Is there any discussion on that one, or is everybody ready to vote?
I have a question.
Yes, sir.
Do we need to delay that? We can make that vote over the next 2 weeks if we need to delay.
That is correct. We can delay it at the next meeting or the following meeting. Okay. All right, Teresa, can you call the roll on that vote?
Yeah. Shob?
Yes.
Ward,
Yes.
Washington,
Yes.
Bowers,
Yes.
Christensen,
Yes.
McGinnis,
Yes.
Raybold.
Yes.
Okay, 7-0.
Is everybody ready to move on to the city clerk? Teresa, would you like to go over the agenda for the city council meeting?
Yes. So right before the directors meeting, I received 2 motions to amend that I then emailed to each of you, I believe.
We just have the one on item 5B. Was there another one?
Oh, here we go. So we have one for 5B, and then we had another one for 5D, which I just sent to you. And it is to adopt a substitute agreement.
Yes. Teresa, I'm going to recognize Tammy for a clarification.
Okay.
To clarify, unless someone else is aware of another amendment.
I haven't seen
Yeah.
the amendment for 5C.
Oh, I don't know what that's about.
The amendment that you're referring to 5C is just an updated agreement between the city and development.
Okay.
It's not uncommon for working in the fill blanks, and that's what this essentially is.
On 5C.
5C.
Right.
But none of us have
Yes.
seen it.
Yes, a substitute amendment.
Is there any chance we can,
It arrived in my email just moments ago.
And between this meeting and the next, we can just have a minute to go through our boxes.
And Mr. Hunziker is working well. If you have any questions.
Well, I guess the question is, I would like to just have a copy of it.
yeah, or a blue, at least a red line? for
Can
the-
somebody make us copies of
Make
that?
a quick red line?
I'll print some.
That would be great.
Are
Okay.
they red line?
I think it would be helpful if we had the red line copies, and then if we have any questions, then we can call Mr. Hunzinger. Or Jeff will attend after all, so. Okay. Teresa, you want to go on?
That's all I had.
That's all you have? Okay. All right. Well, then it should be pretty easy. Okay. And then I'm going to go ahead and step aside, and now we have Jennifer wanted to come forward. Jennifer Brinkman, do you want to give us an update from the mayor? You and I are going to have to share this. What's that? Okay. All right. We're gonna skip Jennifer and go right to Pat Lopez for our interim health director for an update, and I will step aside.
You have a little echo.
I think I put the speaker on the computer itself, because I think it's picking up like what the conference is playing back to that computer. So I think if we take
Just talk.
Okay. I'm coming over. This is not working for me at all.
Here's where
You're muted now. You're muted.
and we need to. So all that does is that mutes it from playing out, but if we unmute on the Zoom, then they'll be able to hear the mic.
Okay.
Nice to know about.
Can they hear now?
Yes, yes.
So I'll make sure he does.
Good.
That probably would be good, right? Good afternoon, everyone. How are you? We're gonna, good. Good, good. We have 56 positive cases in Lancaster County now. You'll hear more about that at the mayor's briefing, but 37 of these cases are community acquired. And you all know that we've had one resident of our community who's passed away from COVID-19 on the 8th of April. We have 4 hospitalizations among our Lancaster County residents, and our testing has improved in the last 2 weeks, especially like last week. So we have our Bryan site at Life Point on 27th and Pine Lake Road, and they're there. In the weekdays, they're increasing their testing to 110 per day there now. And then we have another location at North Star High School, and that one is conducted by St. Elizabeth. So for people to register, they just need to go online and check in that way. They do need a physician order to get the testing done. But if that's an issue, they can go to the Autumn Ridge Urgent Care on North 27th or go into Life Point and be seen there and get it. I think we all heard, I heard Councilwoman Raybold talk about the governor's initiative about stay home and stay healthy, trying to work through that. We have had continue to have calls about the directed health measures and the changes. So we're monitoring that with the public regularly. Omaha still has the highest number of positive cases, followed by Hall County. I think most of you have heard about that situation. And Hall County has had 4 deaths now since the pandemic started. We're also know that we've had cases in long-term care facilities in several locations in the state. Douglas County Health Center had 25 cases and 2 deaths. We had another long-term care facility in Gage County that had 22 positive cases and 1 death. So we're working with our long-term care centers. I think I said that the last time I was here, to make sure we have correct plans in place. The outbreak in Grand Island is involved some of the facilities that they have there, a work site for individuals there. And I think everybody's heard about the Youth Treatment Center in Kearney, where they've also have had some cases there. In our operations branch, we're still working with our lab results and monitoring. Our goal is to increase testing in the community. So we're really trying to push that now that we have more tests available through Bryan and CHI. I've also requested through the requesting route to get additional testing collection kits so that other providers may do testing in the community. We've really been focusing on the move from the women city mission that was accomplished last Thursday and Friday. So they're now moved, and we've had a lot of generous assistance in the community with that. And then we've had a lot of donations on face coverings. I think the mayor mentioned that, but Duncan Aviation has really been working with us. We're working at Lincoln Public Schools. We have a system set up where we have people cutting out gowns, and then they're being transported to the sewers. We're also setting up some decontamination sites in the community so that we can prolong the use of our protective equipment. So those are some of the major calls. We had over a line at the health department, and our environmental health folks are reaching out to the child care centers and talking to them to see if they have needs that we can assist them with. And we've been trying to reach out also to our restaurants to offer support in this time of great difficulty. So we still continue to work with a lot of community organizations. Wondered if there's, and I'm looking at council to say that
last week we talked about a predictive model. We're still using that, but like all things, it's a predictive model, and it's a model. And but it's the Murray model used in Washington, and it's proven to show some accuracy. So our hospitals are providing this information every day, and we're putting that in and monitoring where we're at in the community. And we're still, we've had a slight rise, but we're still trying to flatten that curve. So everything people are doing is really helping, even though it's
to see if we have
sure that, I don't want to say that we know the economics, but we know racial and ethnic. Mhm.
Thank you.
Thank you very much for all you're doing.
Okay, in the essence of time, I think we will go ahead and move on to our public meeting. Would anybody like a break of 2 minutes? Yes. Okay, all right.
Maybe we can get then the copies of the amendment.
That would be great. So we will adjourn and reconvene in, let's say, 5 minutes for the regular city council meeting.
Perfect.
Okay.